How do we diagnose aortic stenosis and what are the treatment options? I am Dr. Vivek Kumar, Senior Consultant Interventional Cardiology at Indraprastha Apollo Hospitals, New Delhi. So, aortic stenosis is a disease, as we have already discussed, where the patient's aortic valve is getting narrowed. And the best modality to assess is echocardiography. On echocardiography, we can assess the severity of aortic stenosis and we can assess has it impacted the heart function or not. The treatment options. For asymptomatic patients, there is no specific treatment apart from reducing the risk factors like controlling diabetes, hypertension, dyslipidemia, and stopping smoking. But in symptomatic patients, we have options of open heart surgery, which we call surgical aortic valve replacement, and a very revolutionary treatment in form of transcatheter aortic valve replacement, which we call TAVR.